It brings multiple perspectives together, from specifically like the caretaker role for mental health, from the social worker and actual like person working with people with mental health and crisis, and then also just the lived experience of trying to navigate institutionalization and these systems.
A few years ago, Duluth-based artists Carla Hamilton and Moria Villiard started a collaborative gallery that they titled Waiting for Beds.
Well, it just started with shared experiences. We were just talking to each other about her as a caregiver and me as navigating through the health system as a woman of color and trying to be your own advocate when you're really sick. And that's very difficult.
In the month of March, the exhibit called UW Superior's own KRUK gallery home, bringing along a message about our region's lack of crisis response in our healthcare system, with a mixture of art and factual graphic design, and being expressive with ripped banners, each reading various situations and conditions people in crisis may experience. The exhibit also gets personal, with artworks incorporating pill bottles and medical documents.
I like taking a lot of things from my experiences and put them in. But we want to let people know it's really hard to be your own advocate and be patient when you are sick and you're in a crisis. How can you fend for yourself?
Past the colorful and self-reflective artwork lies a deeper community struggle to accessible healthcare. The exhibit accepts community submissions, becoming a conversation point, captivating the eyes of spectators, mental health advocates, and care professionals, and even holding an event hosted by the UWS Human Behavior, Justice, and Diversity Department.
It was very, very traumatizing, and the system really is broken and traumatizing, and we need more resources that are more trauma-informed.
I think one of the things that we'll probably get into is that we tend to wait to be in crisis to receive care. I don't think that that's always the best solution.
I mean, listening to other people who are kind of working in this field spans my knowledge and my interpretation of the show. That question of like, what would America look like if people didn't have to wait for a bed?
The art that's in here is beautiful, and it speaks really nicely to the subject that it's about, waiting for beds. And as somebody that works in the mental health field, it's been really nice to see that expressed in a different way that is more than words on a page.
In the KRUK gallery, for the Promethean, I'm Drew Kerner reporting.